have you ever considered, you were about to go for elaborate Vamana or Virechana, but patient was not cooperative. So have you ever considered like quick Vamana or quick Virechana?
Sadhya Vamana, Sadhya Virechana, that can be done. Usually, may be done, but I never go for it. If I want to go it for a totally a classical one. And if you are not willing to go for that one, then why you want to go for a short type of or then curtailed way of doing it? Like, one thing has to be done according to the classical text, which is said very stringently to get the results. If you are not willing for Vamana or Virechana, then better you take Shamana Aushadhis for a longer duration. They also yield the results. It may take some more time. That's the reason.
One of the things that I have observed in you is that you're very clear in terms of whether to go for one thing or not. Like there are no shortcuts or anything. Like in one of the previous classes, you were explaining that, if you give a medicine, patient has to take it. Just because it is proprietary, patient does not have a right to kind of ask you to replace. And even in the case of like Vamana Virechana, will go for full or you will not go. You will go for Shamana. And also in the case sheet, also like there are no shortcuts. Like everything is detailed. So you never take shortcuts and then go for a proper wide approach.
See, very simple reason. If you go for a shortcut, it will cut you short. Many times I have observed if people those who have done that type of shortcuts in some other doctors, they tend to come and say that if I suggested them go for Vamana Virechana, they say, sir, we have already taken, sir. We have been already gone for this, sir. Then I ask them how many days, how you have taken it. Then they will say about this Sadhya Vamana, Sadhya Virechana and all those things. Maybe Sadhya Vamana, Sadhya Virechana to a time being, which gives you a little bit of relief in the symptoms. But if you want, as per my observation, if that in that case and a patient, it is doshik vitiation is too much, then it has to be considered as a bahudoshaja vyadi. Then you have to go for a classical method of shodhana. If you are not interested, then you go for a shamana. Then it may take much more time. That's it. The results will not be there. There is no such hard and fast thing. But the results will be there. But results may be delayed. So if you are ready for such a delay, then go ahead with that. Otherwise, you accept what I am saying, and you should have a belief in me that when I am deciding this one, you should cooperate with that. That is the one basic what I expect from a patient. That is Bishak Vashyata. He should follow the instructions given by the patient. I mean doctor. If doctor says it has to be done like this, if you are willing, you do it. If you are not willing, then don't go it. Go for a Shamana Chikitsa. That's fine. No issues.
And also, I mean, this shortcut mentality has seen with some of the Ayurveda practitioners. So if you are keeping on agreeing with, if you are keeping on making the patient comfortable by compromising on our treatment methods or and changing the medicines based on patient's preferences, and if you keep on like shortcutting the panchakarma and all, like over a period of time, it becomes kind of a unwanted habits in the practitioner's mind, which will make him, which will not bring them a lot of success. So that bad habit also needs to be avoided, and we should be like elaborate and following proper protocols.
See, following a proper protocol is with the anticipation of getting a good results. When we are anticipating a good result, we need to follow the things which is told by our acharyas. But many times it so happens that in a practice there are constraints. We do understand that there are constraints, but particularly that the financial constraints many times makes us to avoid these situations, protocols. Of course, Sadhya Vamana, Sadhya Virechana, I am not against that, but we need to understand that Sadhya Vamana and Sadhya Virechana can also bring down the symptoms marginally and can give instantaneous some sort of relief. I do agree with that. But why I don't go for such things means this type of cases, these are chronic cases suffering from many years. Why I want to give him a very short period some relief, just to want to show that the Ayurveda works? No, the disease nature is like that. It is tend to remain for a longer duration. Kushtam Dirgha Roganam, all skin diseases tend to remain for a longer duration. Then he is supposed to go for the things which I am suggesting. I try to convince them. So this is the method you have to follow. This is the thing you have to go it and you have to follow it. And if you do it, then there will be result. Otherwise, if you want to have, because recently also one of case which I posted in the TCR of the group, where that female with having psoriasis, she is taking that medicine since 4 months, but by the time she is already fed up with that, she is not interested to consume the bitter medicines. She is asking me, going on asking me that change to some other medicine, change to some other medicine. I said, I can't. This is the medicine, it has to be consumed in this way. If you consume it, the things will be settled down. Are you not satisfied with the results? She said, yes, I am satisfied with the result. When you are satisfied with the result, then why you don't want to take it? बहुत कष्ट होता है, it is very difficult to take it, it is बहुत bitter है, all these things are, of course. Then I said, see, these are the medicines are bitter, and this bitter principle, that is Tiktarasa, is doing giving the wonderful result. So you need to take that one. Then she said, I will take it for 15 days. Then by taking 15 days medicine, she will complete those 15-day medicine by 38th day, and then she will delay the things because of this. These are quite common in practice. For that sake, if you are just going on changing the medication and according to their need and things, if you are giving it, then at one fine day, we ourselves will be confused whether I am doing right or wrong, whether the result achieved is real or I say placebo. So all these things will come out of that. So it is better to stick on to our own protocols which we have fixed for these type of diseases. Better to follow it. Any alteration, it has to be yukti purvaka. According to the yukti of physician, treating physician, one has to do it.